A local plastic surgeon was able to reattach a Sunrise man's hand after he accidentally sawed it off earlier this week. Local 10's Kelly Butler spoke to the man's wife and his doctors about this amazing surgery. And now we want to warn you, the pictures that we're about to show you may be a little graphic.
It was a compound miter power saw like this one that severed 44-year-old Abel Pinero's hand.
Basically, this is where the hand was amputated. It kind of went straight across the middle of his hand.
Pinero was cutting wood for crown molding at his Sunrise apartment when somehow his left hand slid under the turning blade. His wife, Sonya, called 911, then looked for the hand.
I put myself in front of the machine, and that's when I saw the hand.
When Pinero arrived at this emergency room, doctors knew reattaching his hand would not be easy. But little did they know his religious beliefs would make the procedure even more difficult.
Abel is a Jehovah's Witness, and Jehovah's Witnesses don't accept blood transfusions, even if they're dying. So I had to change the way I did the surgery a little bit, because during the surgery you lose a lot of blood. And so we use a tourniquet to try to minimize the amount of bleeding.
Plastic surgeon Paul Wigoda performed the 10-hour-long operation at Broward General Medical Center Monday night. Because it was a clean cut, the hand was put on ice and Pinero made it to the hospital quickly. The rare surgery was a success.
Thank God he's recovering. Thank God Paul operated on him.
In Fort Lauderdale, Kelly Butler, Local 10 News.
Now, Pinero is still in intensive care. The recovery process will be a long one. It can take 1 to 2 years for the nerves to regenerate, and even after that, he will never regain 100% use of his hand.
Tonight, 2 South Floridians are beating the odds thanks to the hard work of some South Florida doctors. A word of warning, some of these first pictures will be graphic. 44-year-old Abel Pinero sawed off his hand while working at his Sunrise home Monday night. After a 9-hour operation, doctors at Broward General Medical Center were able to reattach it, and they're now hopeful he will have most of the use of his hand back. The surgery was complicated by Pinero's religious beliefs.
Abel is a Jehovah's Witness, and Jehovah's Witnesses don't accept blood transfusions, even if they're dying. So I had to change the way I did the surgery a little bit, because during the surgery you lose a lot of blood. And so we use a tourniquet to try to minimize the amount of bleeding.
Doctors say they were successful in part because the severed hand was quickly put on ice and because it was a clean cut.
Tonight, a Broward man is talking about his miracle surgery. Doctors reattached his hand after it was severed during an accident with a saw. Local 10 reporter Kelly Butler has his story.
After going through a 10-hour-long surgery and then spending exactly 1 week inside Broward General Medical Center, Abel Pinero is on his way home.
I mean, it looks pretty much like a normal hand.
The Sunrise construction worker is leaving with a very delicate yet somewhat functioning reattached left hand, something he did not think would be possible.
It looks like the wood jerked. When I looked down, I no longer had my hand.
Last Monday, Pinero was using a compound miter saw like this one, cutting wood for crown molding, when somehow his hand slipped under the turning blade. The 44-year-old wrapped the wound with a towel. His wife put the severed hand in plastic and then on ice.
So everything's pretty much perfect except, a scar that he'll have there.
Plastic surgeon Paul Wigoda performed the difficult surgery. Wigoda says the procedure is rare, only successfully completed about a half dozen times a year across the country. In Pinero's case, he had a lot going for him. It was a clean cut, the hand was preserved, and he arrived at the hospital quickly.
So he'll at least have use of the hand to help him lifting things, and, we'll just see how much fine movement he has. That's the only question.
And Pinero is out of the hospital, but his recovery is just getting started. He will have to go through about a year of physical therapy, and his doctor says he will never regain 100% function of his hand.